Hi, I'm Dan. I'm Head of Research and Development at Medik, and this video is talking about what causes blemishes and how we treat them at Medik. So there are quite a few different causes of blemishes, and that's probably why so many people suffer from this concern. And it all starts from a young age. You know, at puberty you've got major changes in your hormone levels, and this can affect the activity of your sebaceous glands, and extra sebum can often mean blocked pores and blemishes. Then as an adult, of course, you've got stress and medication like birth control pills. This can also really affect the amount of hormones you have in your system. Of course, you've got pollution, so this is a big problem if you're in the city. Pollution particles can block pores and definitely lead to blemishes as well. Then you've got other elements of your lifestyle, your diet, for example. If you have sort of a high amount of dairy in your diet, or you have lots of oily foods, this can definitely lead to extra oil and more blemishes. And finally, maybe just a bit of bad luck. Sometimes your genetics play a role. It has been shown that you can inherit acne, so again, another route to blemishes. So blemishes are formed for a few different reasons, and it all starts really with blocked pores or blocked hair follicles. And this can happen from hyperkeratinization or increased sebum production. If you have hyperkeratinization, this is overproduction of skin cells, and this can lead to sort of blockages around the hair follicle. And increased sebum production or an overproduction of oil can stick too many of these skin cells together. Now, the problem with having a blocked pore is that this is when the pore can no longer access oxygen, and this is the optimum environment for P. acne to start growing and spreading. P. acne is an anaerobic bacteria which only grows when there isn't any oxygen access to it. And the problem with P. acne is that this causes the inflammation around the spot, and visibly this leads to the redness around a pimple. So there are two main types of blemishes. You've got non-inflammatory and inflammatory blemishes. So let's start with non-inflammatory. These are called comedones. In other words, they are blocked pores or blocked hair follicles. And you can have comedones that are either closed or open. So if a comedone stays beneath the skin, this is called a closed comedone. And this is visually what you see with maybe a white bump at the skin surface. And then you have an open comedone. This is a comedone that's actually open to the air. And this is what you normally see as a blackhead. And the reason why blackheads form is because you have sebum that's open in the pore, exposed to the air, and then oxidized, and this is what turns it black. And interestingly, this black mark isn't dirt, it's actually sebum that is at the skin surface and is oxidized due to air. And this is why you can't actually wash away a blackhead. And then you have inflammatory blemishes, and there are four main types of inflammatory blemishes. So firstly, you have papules, which are small inflamed lesions and are quite tender to the touch, and these are sort of small little red bumps on the skin surface. And then you have pustules, which are commonly referred to as a pimple. This is when you have at the base of a spot a small papule, and then at the top of the spot filled with white or yellow pus. And then you have nodules, which are large, painful, solid lesions which actually form within the skin and stay within the skin. And lastly, you have cysts, which are deep, painful, pus-filled lesions which can actually lead to scarring. So the key ingredients for blemish treatment, and the ones that are commonly used in skincare, I'd say would be salicylic acid. So this is a beta-hydroxy acid or a BHA. This encourages healthy exfoliation and can clear away blocked oil and sebum within the pores. Then you have benzoyl peroxide, which is more like an antibacterial ingredient to actually kill the acne-causing bacteria. Retinoids like retinol are very commonly used for the treatment of blemishes because they can normalize the keratinization, so the way your skin cells are turning over at the surface. And then you have one of my favorites, which is niacinamide, a very powerful anti-inflammatory to calm and reduce the redness surrounding an inflamed pimple. So the best routine for blemish-prone skin at home definitely starts with cleansing. So it's so important to thoroughly cleanse your skin twice a day. This is going to clear away any impurities or pollution that's built up throughout the day or overnight. And I definitely recommend using a lightweight cleanser or a gel cleanser rather than a cream cleanser for this type. So of course it's important to moisturize your skin, but between cleansing and moisturizing, I definitely recommend a treatment product like blemish control pads. Blemish control pads contain 2% salicylic acid to help clear away, reduce blemishes and to prevent future breakouts. So following your treatment product, I definitely recommend a lightweight moisturiser like the Medik Blemish Moisturiser. There's a great texture suitable for acne-prone skin. It's not going to block pores, and it also contains niacinamide, which is a very effective anti-inflammatory to calm the inflamed red area around a spot. And maybe if you're prone to the odd spot or the odd pimple every now and again and you're looking for a quick fix on the spot treatment, I definitely recommend Beta Gel, which has a cocktail of very effective ingredients to very quickly reduce the visible signs of acne and blemishes.